daily life in the Audiology Department looks a lot like assessing hearing loss and different ear-related disorders. We can evaluate the outer, middle, and inner ear, and we often work with ear, nose, and throat physicians on treatment plans for these types of things.
What makes our team unique is that we have a team of 8 incredible audiologists, and we're also growing, that will help patients decide what hearing technology is best for them. That could be a bone-anchored hearing aid, that could be a cochlear implant, or that could be a traditional hearing aid. There are different styles of hearing aids, there are different technology levels, and the market is ever growing, and we are here to answer those questions for patients. What also makes us unique is that we have a full hour with patients to go over their needs, what they would like for their hearing aid to do, what connectivity looks like, even what color they want. And we spend all that time making sure that their needs are met and that they are happy with their decision.
Other unique parts of our program include vestibular testing. We're often working with ear, nose, and throat physicians, neurologists, and physical therapists in a multidisciplinary approach to assess inner ear disorders related to vertigo and dizziness. We often collaborate with other physicians here at NM for ototoxic monitoring cases. This happens when a patient may be taking certain medications that have ototoxic properties, in which case we need to monitor their hearing as they go through the treatment to detect any potential change. Other side effects of ototoxic medications can sometimes include tinnitus, and that's something that we work with a lot here.
Our audiologists, or our team, can talk to patients about their tinnitus, suggest treatments, send them elsewhere if they need more specialized treatment, as well as recommend some strategies that they can use. For example, using white noise during bedtime, avoiding silence, and then watching their stress levels.
Hearing aids also have different tinnitus platforms, so we'll often use different hearing aid technology with or without hearing loss just to mediate the tinnitus that they're experiencing and try to work with them in terms of a more sound therapy approach.
Something that others may not know that we do is we also do inpatient audiograms. So for patients who can't necessarily leave the hospital room, we come to them, we can perform hearing tests and just to help their physicians decide what the next steps should be.
This can happen if there's a sudden hearing loss while undergoing treatment while in the hospital, or if they're admitted due to a sudden hearing loss due to some type of accident or something else.
During our hearing aid selection appointment, the patient is walked through the differences between a prescription hearing aid, which is what we offer here, versus like over-the-counter hearing aids or anything new that's out on the market. Our audiologists have a wealth of information about the difference between the two, as well as the newest technologies that come out. Now, once the a patient is fit with the hearing aid, we do go through verification processes, not only asking them how they are functioning in the real world, but also verifying with our special equipment, making sure those hearing aids are giving them adequate gain, making sure they are functioning correctly, and just in general working well. Our team is excellent at meeting the patients where they're at. For example, modifying our testing procedures to meet their cognitive abilities or their physical abilities, or both.
Our priority is hearing healthcare.